Did you know? About 50–70% of women experience some type of breast discharge in their lifetime. If you've ever noticed discharge from your breasts, you're not alone. Breast discharge is more common than most people realize, and while it can be harmless, it's sometimes a sign of something more serious. Today, we're diving into what causes breast discharge, how to identify what's normal or abnormal, and when to take action. Welcome back to my channel. Breast discharge can happen to women of all ages, and it doesn't always signal a problem. In fact, in many cases, it's completely normal. But how do you know if it's something to bring up with your doctor? Whether it's occasional or frequent, clear or colored, breast discharge can feel alarming, so I'm here to break down everything you need to know. First, let's tackle the question most people have. Why does breast discharge happen, and when should you be concerned? Many women worry when they notice discharge, fearing it could be linked to breast cancer or other health issues. However, discharge on its own is rarely a standalone symptom of something serious. The truth is, breast discharge is often the result of changes in hormone levels, certain medications, or even the natural aging process. Understanding these different factors can help ease your mind while also helping you recognize when a doctor's input might be beneficial. The various types of breast discharge and their potential causes. Different types of discharge can mean different things, so it's important to understand the specifics. The most common types. 1. Clear or milky discharge. Clear or milky discharge is usually nothing to worry about, especially if it occurs from both breasts. This type of discharge often results from hormonal fluctuations, like those during the menstrual cycle, pregnancy, or even after breastfeeding. It can also be triggered by nipple stimulation or as a side effect of certain medications like antidepressants, birth control, or blood pressure medications. 2. Yellow or greenish discharge. This may look unusual and can indicate infection or inflammation within the breast. If you're experiencing symptoms like pain, redness, or swelling along with this discharge, it could be related to an infection or mastitis. Mastitis is common among breastfeeding mothers but can also occur in other women, particularly if there's a cracked or irritated nipple that allows bacteria to enter. 3. Bloody discharge. Bloody discharge tends to be the most concerning and can be alarming to see. While bloody discharge doesn't automatically mean cancer, it is a reason to consult a doctor. One common benign cause is a condition called an intraductal papilloma, a small, non-cancerous growth in a milk duct that can lead to bleeding. However, in some cases, bloody discharge may require further testing to rule out cancer. 4. Pus-like discharge. Lastly, a pus-like discharge that has a bad odor might indicate an abscess or a serious infection. This is a sign that you should seek immediate medical attention, as infections of this nature may require antibiotics or other treatments to heal properly. So, when should you be concerned about breast discharge? Here's what experts recommend watching out for. Red flags checklist. 1. Discharge that occurs without any squeezing or pressure on the breast. 2. Discharge that only comes from one breast. 3. Bloody discharge or discharge that appears suddenly. 4. Discharge accompanied by other symptoms like pain, redness, or the appearance of a new lump. If any of these apply, it's best to reach out to a healthcare provider. A doctor can help determine the cause through a physical examination, and if needed, imaging tests like an ultrasound or mammogram. Remember, early evaluation provides peace of mind and ensures any issues are addressed sooner. Hormonal changes. Let's take a closer look at what might be causing these changes. Hormonal fluctuations are a major reason, especially during times like pregnancy, menstruation, or menopause. Breast discharge related to hormonal changes typically isn't harmful and may fluctuate with your cycle. Lifestyle tips. If you notice discharge due to hormonal reasons, focusing on balanced diet, regular exercise, and stress management can often help. Reducing stress can actually make a difference, as stress can affect hormones and might trigger discharge in some cases. Medications and infections. Some medications, like birth control or certain psychiatric medications, can cause discharge as a side effect. If this becomes uncomfortable, consider discussing alternatives with your doctor. As for infections, keeping the nipple area clean and dry can prevent bacteria from entering through small cracks, which is especially important if you're breastfeeding. To wrap up, breast discharge is quite common and usually not something to worry about. However, knowing what's normal for your body and watching for any sudden or unusual changes can help you stay on top of your health. In general, discharge from both breasts that's clear or milky is rarely a cause for concern, while persistent, bloody, or one-sided discharge might be worth bringing up with your doctor. Thanks for watching. If you found this video helpful or if you have questions, leave a comment below. And if you're interested in learning more about breast health or women's wellness, make sure to check out my other videos. Don't forget to like, subscribe, and turn on notifications so you don't miss out on future content aimed at empowering you with health information. Take care, and see you next time.